and I am here today representing many families. I work for an organization called RAD Advocates. I myself have experienced parenting a child with reactive attachment disorder. That experience led me into starting an organization to advocate for other families, caregivers, and children who are struggling with reactive attachment disorder, or known as developmental trauma disorder. As an advocate, I attend many meetings with families, whether it's family treatment meetings with DHS, creative solution meetings with Medicaid. We advocate for families here in Colorado, but we also advocate for families all over the United States because, as we know, mental health is everywhere. What I see within our state of Colorado is appalling. I know I've heard the Colorado Mental Health Care Act. When we tried to access that for many of our families, that was tapped out by February 1st. So that is an avenue that people can use as a resource if they financially cannot get the mental health resources or funding that they need, but it was tapped out by February. What's so disheartening to me is that families with reactive attachment disorder fall through the cracks. It's considered to be rare, and it's rare in the general population, but it's not rare to adopted families or children in the foster care system. We work with families that are forced to turn over custody of their children to receive care. That is unacceptable. Imagine if a child had cancer and the parents were told, in order to get your child help, you have to give custody of your child over to a group of professionals that are only learning your story in an hour family team meeting, and then they get to determine the trajectory of your family's care and needs. It's unacceptable. Families get caught up in this vicious cycle that we call the emergency room, the RTC home. Emergency room, RTC home. This happens many, many a times. Our RTCs are not equipped to handle children with reactive attachment disorder. We have worked closely with one residential treatment center here in town that is working on understanding it a little bit more. But the director there, he himself even agrees that they are just warehousing the children. When families are scared to bring them home because this disorder becomes a family disorder, the behaviors that are exhibited through the mental health illness of the disorder traumatize the other children in the home. Now we have more than one child in the home suffering with mental health issues because of the disorder itself, and a group of professionals that are supposed to be the resource that families can go to for help that do not understand what this disorder looks like in the home environment. So when we are placing our children in therapy and residential treatment centers and acute hospital stays, the disorder presents very differently there. And because of that, because the child is not triggered, because they've been removed from their reactive attachment, they are calm. So therefore, they do not meet level of care to stay. And then they're sent back home, and the trauma cycle begins for that child, as well as the other siblings in the home and the parents. I have worked with families where a mother has had a knife held to her neck by her 14-year-old son that was released from an acute hospital stay because he did not meet criteria to go back to an RTC. She brought him home 14 hours later to be held at knife point. Her other children witnessed this. Luckily, her husband was on the phone and recognized that something was wrong and called the police. When she refused to pick that child up, I believe it was less than 24 hours later, because she did not feel that he was safe and regulated to return home. She now had a case with DHS where they turn it into a parenting issue. This is not acceptable. Families are disrupting, they're falling apart, and children are being failed. My personal opinion is I feel that at the residential treatment center level, We have entry-level clinicians. They are not skilled to handle mental health like DID, reactive attachment disorder. They are not skilled. They are fresh out of school without the experience. The professionals that we need are the professionals that have years of experience under the belt of hands-on working with this mental health. That's who needs to be in the acute hospital settings. That's who needs to be in our residential treatment centers, not fresh out of school clinicians that are barely even maybe having a chapter on the subject. Our traditional therapy styles do not treat reactive attachment disorder. It's a very specific treatment and it's very counterintuitive to what is out there. But I'm here just to say that I advocate for many families, and our system is very broken. And in these meetings, we have DHS and we have Medicaid and we have the private therapist and we have private insurance on the line, and everybody's trying to figure out the loophole of how do we get the child help. And I don't know what that answer is, but I just wanted to bring to light that it's broken and many families are falling apart because of it.